So hi, I'm going to be talking today about understanding trauma-related dissociation and its role in a wide variety of disorders, including psychosis. Psychosis is a primary area of interest to me, but in trying to understand it, I've really had to wrestle with trying to come up with a broader understanding of dissociation, which plays an important role in psychosis, but also it turns out in a lot of other mental disorders, even though it's not commonly recognized that these disorders can be understood as resulting from dissociation. But I hope after you hear this presentation, you'll have at least an understanding of that viewpoint, that those can be understood as dissociative. Now, in making this presentation, I was especially influenced by two books, and one of them is The Haunted Self, or Structural Dissociation and the Treatment of Chronic Traumatization. And a second book that I was really influenced by was Psychosis, Trauma, and Dissociation, Emerging Perspectives on Severe Psychopathology. Now, in talking about this, obviously it's important, like, what we mean by dissociation. And I think in its simplest sense, what we're talking about is just the opposite of association. In this sense, some degree of dissociation is essential to all human functioning. Without it, there's no capacity to keep things mentally separate, to see things as not associated. But when we have what has been called systematic or structural dissociation, then we have an organization within the mind which is where there's different systems or subsystems of the person which are just unduly rigid, and they're closed to each other. They're kind of just too closed off. This leads to a lack of coherence and lack of coordination within the person, which is where the problems start happening. Now, I'm also going to try to just present a pretty simple understanding of how trauma causes dissociation. I think that some of the underlying dynamics are pretty simple, even though, of course, there's innumerable complex variations. But when we're in a traumatic situation, it at least seems to be required that we have to go to some kind of extreme. We feel that our life or something essential is in danger, and we're willing to go to extremes. And we're often thinking in kind of black and white terms, like either this is going to save me or kill me. And so dissociation can easily occur. At other times, maybe at one point we may wall something out, like we absolutely need to not have that or not see that or not go there at all. And other times that very thing may be the exact thing that we need to move forward. And so there can be a swing between opposites in our reactions to trauma. But instead of integration of opposites, we end up with conflict, lack of integration. Some traumas are really kind of more slow. They aren't the sudden impact kind of things. But an example might be a person who feels forced to choose between their sexuality and, let's say, spiritual wholeness, or maybe social acceptability. In other words, something that's very vital to them, and yet that interferes with other things that are totally vital, and so they're kind of torn there, and they don't manage to integrate those two. And that can also be seen as a dissociative process. So the most common kind or type of structural dissociation, when it really becomes part of the way a person is put together, is a dissociation into what's been called an apparently normal part, or abbreviated A&P. And that's the part that after a trauma wants to move on with daily life and avoid traumatic memories or upsetting emotions. It's Yeah, it just kind of like seems like a mainstream person. It's easy to think you're talking with the whole person if you're talking with a person who's just speaking from that part of themselves. But then in contrast to that is the emotional part, abbreviated EP, and that part is fixated on action systems that were activated at the time of the trauma. So it's likely to have vehement emotions and emotional reasoning that's not tolerated by the A and P. It's all oriented maybe, like the trauma. Let's say we're talking about a very threatening event, it would be the part that's all oriented around defense against that kind of event. For example, the person in war may have part of them that's still oriented towards ducking and hiding when there's a loud noise. Now, obviously, the apparently normal part is not going to like having that part around because it's, it's being hypervigilant and overly reactive. Now, in the case of slower trauma, like I use the example of someone whose sexuality isn't integrated. In that case, the sexuality would be kind of playing the role of the emotional part there. And the apparently normal part would be disowning it, pretending not to have it, and trying to move on with life without it. But obviously, neither one represents the whole person, even though the apparently normal part more likely seems to represent the whole person. In everyday emotional problems, there is also kind of have this basic structure of the A and P, EP. If you look at, let's use the example of a person who's afraid of being in crowded movie theaters. They may come into a therapy office and saying, I've just got this fear of being in a crowded movie theater, it makes no sense, I want to get rid of it, can you make it go away? Can you give me a pill or give me some way to just block it out so I don't have it anymore? And at their point, they're kind of like avoiding the emotion that they don't feel like makes any sense. And so that's kind of like the A and P side of things. Now, on the EP side of things is more like the point of view of the emotion itself. So what might happen is that person actually tries going to the movie theater and, is trying to wall out that fearful part of them, but the fearful part, meanwhile, is thinking, gosh, there's more and more people coming in, this is terrible, oh my God, I'm surrounded. And at a certain point, the EP might have strong enough emotions that it just kind of takes over and the person runs out of the theater. Their kind of emotional reasoning, well, it feels scary, so it must be terrible, I've just got to get out of here. Now, what we're trying to do with emotional problems is to help people integrate both sides of themselves so they can take the position in the middle ground here where their feelings and emotions give them suggestions about what may be real. In other words, they integrate them and listen to them, but then they kind of can make executive decisions about deciding whether those emotions are accurate in that particular situation. And if they are, if the theater seems really dangerous, they leave, and if not, they just accept, okay, this feels scary, but I need to work through my fears, so I just feel the feeling and let it go. That's what we're trying to go to. Obviously, it's not always that easy. Now, each extreme has its own costs and benefits, and I think it's helpful to understand that. The apparently normal part, it's good at going on with daily life, but it's also kind of oblivious to threat. So the person might feel safe inside and be able to get on with rewarding activities in life because they're just not thinking about the traumatic event or danger related to the trauma and all that. And that when they're in that mode, they aren't going to be bothered by perceiving threats that aren't real, that aren't present, but they might miss threats too because they're blocking out that perception of threat. Now, from the emotional side of view, they're very vigilant for threat, or don't get caught unawares, but also have to deal with a lot of false alarms and inner turmoil. They're not feeling safe inside, missing out on things due to hypervigilance. Again, what we're after ultimately is an integration, which is a balance between vigilance and deciding when a person is worried enough, the ability to keep an eye out for threat, but also notice when the person's getting hypervigilant and then just let go some and relax. Now, of course, one of the complexities here is that in different situations, different degrees of vigilance are obviously called for. And sometimes it's not clear to the person just what is their situation. Is their vigilance realistic or is it not? So, so these things, there's a lot of complex factors and how to integrate, but we know that ultimately we're meant to have both the ability to see threats and focus on them, but also find a way to not do it too much. Now, what are the consequences when people dissociate something? When they wall it off, don't want to have anything to do with it, or just totally go into denial about it. Well, what happens is that which is dissociated takes on some kind of life of its own. And this is part of the phenomena within the mind of what's called self-organization. Now, self-organization is a concept that comes out of complexity theory and just how complex systems work. But whatever we don't integrate, even if it's just a simple affect, a simple feeling, or a simple sensation, has to some extent its own sense of I. Its own sense of being something on its own. And it's the lack of it being integrated that gives it that sense of I. If we let something into ourselves more, it just becomes part of our overall bigger sense of I. It doesn't so much have its own sense. Now, it's kind of interesting to look at self-organization, in this case within biological systems. This slide shows the life cycle of the slime mold, which might seem silly to compare that with human beings and minds, but I think what's interesting about it is that at one point in the life cycle, this creature is just a bunch of independent one-celled organisms all crawling around. And then at a certain point, when the food supply runs low, they send out one of them starts sending out a signal, and then they all start aggregating, and then they form into like one creature, which moves as a coordinated whole, finds a good place to form into a body and release spores, and then goes back to being individual creatures again. Now, I think you can also ask that same question with humans. Are we really one entity, or are we a composite of many parts? Now, scientifically, we know there's just a whole bunch of cells that come together to make who we are, and obviously a whole bunch of different perspectives that we have to integrate into one overall sense of ourselves. Now, sometimes, when those parts aren't very integrated, then each part has a life of its own, and that's what I think is the thing that is both interesting and very perplexing to the person who's dealing with it, to a person who has something that they've maybe a lot within them that they've kind of like walled off or tried to disown.